After sitting out the start of the regular season while recovering from 2 off-season shoulder surgeries, it's officially time for the Paul George era to begin in Los Angeles as he makes his debut for the Clippers. Welcome back everyone to your #1 source for everything related to sports injuries and sports medicine news. In this video, we're finally, after many requests, going to take a look at Paul George's shoulder surgeries, specifically talking about his rotator cuff tear. Between the 2 surgeries, the first for the rotator cuff on his shooting side on the right, and the other for a labrum tear on the left, I think the rotator cuff one is, first of all, more interesting, and second, potentially going to have more implication for the season coming up. Now, I will say too, before we get started, I know my background looks kind of crummy today. This is just a paper backdrop. It fell off the wall. It's all bent. It's pretty bad looking, so I apologize for that. So bear with me here while I still try to bring you guys content and get this fixed and get a new one. But for right now, make sure and go subscribe if you like this type of content and want to stay up to date with my future videos. And let's get started talking about Paul George's rotator cuff tear. Clearly at the end of the season last year, there was something going on with Paul George's shoulder. His statistics dropped. We saw him wearing all these different kinds of taping patterns on not just his right shoulder, but also his left. And there was some early rumor that he had a possible slight rotator cuff tear. Sure enough, then fast forward to the offseason and we found out he did in fact have a rotator cuff tear, specifically a partial tear to the supraspinatus tendon, which, as we'll talk about in a bit, is one of the 4 muscles of the rotator cuff. Let's start off by talking about the anatomy of the rotator cuff, and then we'll dive into some of the mechanisms for how these injuries occur, what might have been happening with Paul George, and then we'll talk about the type of surgery that he could have had to fix this. The rotator cuff is made up of 4 muscles that start on the shoulder blade and then insert at the top of the humerus to provide some support to our shoulder joint and to also help with basic movements of our shoulder. The common acronym we use is that they're the SITS muscles. It's the supraspinatus, the infraspinatus, the subscapularis, and the teres minor that are the 4 muscles that make up the cuff. One of the ones that we typically see the most, and was the case with Paul George, was the supraspinatus muscle, and so let's focus on that one in a little more detail. Your supraspinatus originates on the top portion of the scapula and then travels out underneath the acromion and then inserts out on the humerus. This muscle helps to initiate abduction of your arm, so it helps to start with this movement of lifting your arm over your head. Before we move on, a key portion of the anatomy to understand here with this specific muscle is an area we call the subacromial space. Your acromion is this kind of bump that comes up on the top of your shoulder blade, and you can actually feel it on yourself. It's kind of this bump on the far outermost part of your shoulder, and we can see it here on our anatomy picture. This space below the acromion is called the subacromial space, and it's particularly important when it comes to rotator cuff damage. Whenever you raise your arm up, what happens is you rotate the humerus up in such a way that it makes that subacromial space smaller and can pinch the structures between the acromion and the humerus. There's this bump on the outside of your humerus called your greater tuberosity, and whenever you raise your arm up, that greater tuberosity comes closer to the acromion, and so if you have any sort of pathology or disease in that area, that idea of it getting pinched can cause some additional pain and could be part of what was going on with Paul George. Let's talk next about how rotator cuff tears occur. There's 2 general categories to think about here. The first is sort of degenerative tears that happen as a result of overuse, particularly as we just age and use our shoulders more. If you were to take an MRI of a lot of older people, most likely they're gonna have some degree of partial tearing in their rotator cuff, just simply from how we use these muscles over time. And a lot of these, in fact, aren't actually symptomatic. The second category, which is what most often applies to athletes, is when you have an acute, sudden traumatic tear of this tendon or muscle. Just like you can get a hamstring tear or quadriceps tear, you can also get a tear of your rotator cuff muscles. A lot of times we see these happen after someone falls on their shoulder or falls on an outstretched arm, causing excessive stretch and pulling of those muscles and tendons that cause them to partially or fully tear. We couldn't tell specifically when Paul George had his injury, but we could at least attribute it to 1 or 2 games. This makes me think that at some point during one of these games, his arm got caught in such position that caused more of an acute, sudden partial tear, rather than it being the result of repetitive trauma or repetitive injury. So regardless of how this tear happened, why was it causing so many problems and having a big impact on Paul George? This comes back to the idea of what the supraspinatus muscle is trying to do whenever we move our shoulder, and also possibly that idea of impingement between that space below the acromion. There was one point where Paul George said his pain was so severe that he couldn't even raise his arm, and that's what the supraspinatus muscle is trying to do. It's raising the arm, starting that initial abduction. But just on a nightly basis with his shooting, how would that affect things? Well, think back to what I talked about with this idea of impingement. In some instances, when people have rotator cuff tears, they can also get symptoms of impingement. So whenever you raise the arm up over your head, you pinch that space between the muscle of the rotator cuff and the acromion of the scapula. And if there's already damage and irritation there, pinching it repetitively by raising your arm causes you more pain. This was on Paul George's shooting side. And so every time he is raising his arm up to shoot, he's causing repetitive narrowing of that space and causing some potential impingement. Let's talk next about how we manage these types of tears and relate it to Paul George's case. If someone has an acute, sudden, complete full thickness tear of their rotator cuff, typically you're gonna have surgery. There's not really that much debate. Where it gets more challenging is the cases where you don't have a complete full tear of the tendon and you have just a partial tear. A lot of times partial tears will first be managed conservatively with just rehabilitation. A lot of times these tears can become asymptomatic over time, and so a lot of the rehab is focused on strengthening the rest of the rotator cuff muscles to make sure the shoulder is moving properly and trying to limit the pain and stress on that tendon. But sometimes surgery is done, especially in someone who's a high-level athlete like a Paul George. There's a lot of factors that play into the decision of whether or not to have surgery for something like this. And so instead of talking about all the little intricacies that might have been specific for Paul George, I want to talk instead about the kind of general types of surgeries that they'll do sometimes for these types of tears. One of the first things the surgeons might consider doing is simply debriding or cleaning up the damaged area of the tendon. If the tear is small, if there's a lot of other good healthy tendon left and it's in specific locations, then sometimes this can be the best outcome for the specific individual. Then in some cases, they'll actually do a repair of the torn tendon where they essentially try to suture or anchor it back down to the bone. And the third thing that the surgeons will sometimes perform is something called an acromioplasty. This again goes back to that idea of impingement, where sometimes individuals are more predisposed to the way that the arm bone will pinch underneath the acromion. Acromioplasty is whenever the surgeons go in and basically remove part of that acromion to basically increase the space to decrease the possibility of having impingement. Whether or not the surgeons did something like an acromioplasty to decrease the possibility of future impingement in his shoulder is probably one of the key things that might determine how he'll do the rest of his career in this season. If Paul George is predisposed to this pattern of impingement, then he could have additional problems with his shoulder. But if the doctors thought that was going to be an issue, then they probably would have considered doing something like this acromioplasty to lower that risk and give him more space for whenever he's repetitively shooting and raising that right arm. When Paul George comes back, it's also going to be important to watch for injuries to other portions of his body just because of how his training focus might have changed while he was rehabbing. When you're rehabbing an injury, it's really easy to focus on just the specific injury, so rehabbing your shoulder, rehabbing the arm, that it can be easy to forget about the rest of your body. Rotator cuff injuries are generally pretty rare in basketball, and so especially having this done on his shooting side, knowing that he's going to be subjecting his shoulder to additional repetitive motion for the rest of his career, it'll definitely be something interesting to watch and keep a close eye on to see how his body responds after coming back from the surgery. That's it for the video though, everybody. I hope you guys learned something about rotator cuff injuries and what happened here with Paul George. Let me know any questions or comments you have below, and until next time, we'll see you later. Bye.